The alarming rise in avoidable mortality across all U.S. states, contrasted with steady improvements in most other high-income nations, is a glaring indictment of systemic failures within the American healthcare system. Despite outspending every other country in the world on healthcare, the U.S. continues to suffer from declining life expectancy, deepening state-level disparities, and preventable deaths that expose critical weaknesses in both policy and execution. This is not just an abstract statistical problem. It is a tangible crisis that is costing lives on a scale that should not be acceptable in a nation with the resources and medical advancements that the U.S. possesses. Avoidable mortality, which includes deaths that could have been prevented with proper public health interventions or timely medical care, has increased across the board in the U.S. since 2009. Meanwhile, in most of the 40 European Union and OECD nations studied, avoidable deaths have actually decreased. This contrast is damning and points to a broader, systemic issue that is uniquely American. The fact that every single U.S. state experienced worsening mortality rates suggests that the problem is not confined to individual state policies, but rather rooted in national failures that are disproportionately harming the most vulnerable populations. A major contributing factor to this decline is the fragmented, state-dependent nature of American healthcare policy. Unlike other high-income nations that have centralized systems designed to ensure access to preventive and emergency care, the U.S. leaves crucial health policy decisions, such as Medicaid expansion and public health funding, to individual states. The result has been a widening gap in health outcomes, with some states managing better than others, but none keeping pace with global improvements. This decentralized approach has created a patchwork system where access to life-saving medical care and prevention programs depends largely on geography, rather than need. The pandemic further magnified these disparities, with states that already had high avoidable mortality rates suffering even more extreme increases in preventable deaths. Even more troubling is the complete lack of correlation between healthcare spending and health outcomes in the U.S. While other high-income countries show a clear relationship between increased health expenditures and lower avoidable mortality, the U.S. remains an outlier. Spending continues to rise, but the results are not improving. This suggests that the issue is not a lack of funding but a profound inefficiency in how resources are allocated. Rather than prioritizing broad, systemic improvements in public health and preventive care, much of the U.S. healthcare system remains focused on expensive, reactionary treatment that does little to improve overall population health. The COVID-19 pandemic further exposed the fragility of the U.S. healthcare system, pushing avoidable mortality rates even higher. While the entire world faced increased mortality during this period, the U.S. saw one of the most dramatic spikes, particularly in states that already had weak public health infrastructure. This reinforces the argument that avoidable deaths in the U.S. are not just an unfortunate consequence of modern life, but a direct result of systemic policy failures. The fact that the hardest-hit states were those with already high mortality rates indicates that the cracks in the system were well established long before the pandemic hit. It is also worth noting that the study found a statistically significant negative correlation between health spending and avoidable mortality in other developed countries, meaning that in those nations, increased investment in healthcare leads to better health outcomes. In the U.S., however, no such correlation exists. This is an indictment of a broken system where excessive spending does not translate to meaningful improvements in population health. The inefficiency, inequity, and lack of coordination within the American healthcare system are costing lives at an unacceptable rate. Policymakers cannot ignore these findings. The steady erosion of U.S. health outcomes should serve as a wake-up call that the current approach is not working. The country needs a fundamental restructuring of its healthcare system, one that prioritizes prevention, ensures equitable access to care, and eliminates the extreme disparities that have allowed some states to fall so far behind. Other high-income nations have demonstrated that progress is possible, but the U.S. continues to lag behind, trapped in a cycle of inefficiency, political gridlock, and systemic neglect. Without serious reforms, this trend will only worsen. Avoidable mortality is not just an abstract statistic. It represents real people whose lives could have been saved with the right policies in place. If the U.S. continues on its current path, it is not just a failure of governance, but a betrayal of the fundamental promise of a healthcare system to protect, and improve the lives of the people it serves.